Hey guys, welcome to my channel. So in this video we are going to look at the pharmacology part of the general anesthesia. So this is a very important topic in the pharmacology. Make sure you watch the video till the end. So let's move on to the pharmacology of the general anesthesia. So what is general anesthesia? So any drug that induces reversible loss of consciousness, any drug that induces reversible loss of consciousness and all other sensations. So this is the general anesthesia, reversible loss of consciousness as well as the all other sensations must be lost. And what are the features of the general anesthesia? Let's see that. So as I said, there should be reversible loss of consciousness. The consciousness should not go permanent, so there should be reversible loss, and there should be reversible loss of all the sensations, that is the touch, pain and everything. Then they should also produce analgesia as well as the amnesia, that is analgesia, no pain should be there, amnesia and no history of what happened for me, so that also, that memory part should not also be there. Then they should also produce muscle relaxation as well as abolish all the reflexes. So these are all the features of the general anesthesia. There should be reversible loss of consciousness, reversible loss of sensation, analgesia, amnesia, and they should also produce muscle relaxation as well as abolish all the reflexes of the human body. So these are the features of the general anesthesia. Now what? Since there is no single anesthetic agent which is able to produce all the above effects, you know that there is not even a single agent which produce all of these desired effects in the general anesthesia. So what do we have? We have something called as the anesthetic protocol. So let's see that. So first step is the pre-medication. So before you put the person into general anesthesia, we'll give a set of medications prior to that. So they are called as the pre-medications or pre-anesthetic drugs. So what we'll have a separate discussion on this topic, pre-medication anesthetics. Make sure to watch that. Then after the pre-medication, we will induce the anesthesia, that is the induction of anesthesia using propofol, thiopentone or whatever it is. Then we look at the maintenance of the anesthesia. So this is for the induction, and maintenance we will do using nitric oxide plus isoflurane, desflurane, sevoflurane. We look at the classifications of all that. Then finally we will also put skeletal muscle relaxation. Skeletal muscle relaxants also will be induced. Then there should be analgesia as well as the reversible neuromuscular blockade. So this is the anesthetic protocol, that is the pre-medication, the induction of anesthesia, maintenance of the anesthesia using the nitric oxide and isoflurane, skeletal muscle relaxation, analgesia as well as the reversible neuromuscular blockade. So now let's look at the site of action of general anesthesia. So general anesthetics, they act at reticular formation, that is the state which maintains the consciousness of the person. So it acts there, thus putting the patient into sleep. Now let's look at the important part, that is the mechanism of action of general anesthetics. So what is the mechanism of action? It's also very important for the UG examinations, so please listen to it carefully. They enhance the activity of inhibitory neurotransmitters. So they enhance the activity of the inhibitory neurotransmitters like GABA, that is the benzodiazepines, barbiturates, propofol, whatever it is. They enhance the activity of inhibitory neurotransmitters like GABA. So when they are enhanced, what happens? They also block the activity of excitatory transmitters. We have glutamate and aspartate. They are the excitatory transmitters. They also block the activity of the excitatory transmitters such as ketamine as nitric oxide. Thus highly reduced transmission in the reticular formation. So because of blocking excitatory and increasing the inhibitory, there is highly reduced transmission in the reticular activating system, which keeps the consciousness of the person. So what happens after that? There is decreased state of consciousness. So slowly the person starts losing the consciousness, and finally the patient will enter into a state of unconsciousness till the end result is achieved. So as long as we are inducing the general anesthetics, the patient will be unconscious, and slowly when we remove all of this, then the patient will come back to normal. As long as the end result is achieved, we'll put the patient into the state of unconsciousness. So this is about the mechanism of action, that is they enhance the activity of inhibitory transmitters like GABA, and they block the activity of the excitatory transmitters like glutamate. Then the highly reduced transmission will be present in the reticular activating system, thus following the decreased state of consciousness in the patient, finally going into the reversible state of unconsciousness. So now let's look at what are the different stages of anesthesia. So firstly we have something called as the first stage of analgesia. So the patient feels drowsy but is consciousness. So when you just start acting, the patient feels drowsy, and but he is still conscious. So that is the first stage of analgesia. The second stage is called as the stage of excitement. So the patient loses consciousness. Now that we have induced general anesthesia, the patient is unconscious. But what happens? The sympathetic activity will get increased. So the sympathetic activity will start getting fired. So thus resulting in the increased heart rate, increased BP. The pupils will dilate. The breathing of the patient is irregular, as well as the muscle tone is increased. So we have a second stage that is called as the stage of excitement, where the patient loses consciousness, but the sympathetic activity gets fired up, causing the heart rate of the patient to increase, BP to increase, the pupils start to dilate, breathing is irregular, and the muscle tone is also increased. So this is a very important part of the anesthesia, that is the second stage of excitement. Then we have the third stage called as the stage of surgical anesthesia. Here what happens? The respiration of the patient is regular. The muscles will, all the muscles will start to relax. The reflexes are completely lost. The pupils are dilated and the eyeball is fixed. So these are all the features of the third stage, that is the stage of surgical anesthesia, and it is during this stage that the surgeon will perform the surgery. Then finally, from the third stage, we should not leave them to progress to the fourth stage. The fourth stage is called as the stage of medullary paralysis. So in this stage of medullary paralysis, the respiratory as well as the vasomotor center both are depressed, and the death of the patient will occur within a few minutes. So this is about the fourth stage of the anesthesia. So now let's look at the classification of the general anesthesia. So when it comes to classification of the general anesthesia, we have the parenteral route as well as the inhalation route. We will give IV, that is parenteral route, as well as the inhalational route. When it comes to parenteral, we have some drugs called as the inducing drugs. When we just start the process of anesthesia, these drugs are called the inducing the drugs, and during the and also the second one is called as the slow acting drugs. And when it comes to inhalational, we have volatile liquids as well as the gas. So this is the classification, parenteral and inhalation. In parenteral, we have the inducing drugs as well as the slow acting drugs. In inhalational, we have the volatile drugs as well as the gas. So what are the inducible drugs we have? Inducing drugs are the propofol, etomidate, thiopentone as well as the methotrexate. So these are the inducing drugs in the general anesthesia: propofol, etomidate, thiopentone and methotrexate. Then we have the slow acting drugs. They are the benzodiazepines, that is the diazepam, lorazepam, midazolam, ketamine, fentanyl and ramifentanil. So these are the slow acting drugs: diazepam, lorazepam, midazolam, ketamine, fentanyl and ramifentanil. Then we have the volatile liquids. They are those general anesthetics which help in the maintenance of the general anesthesia. So after inducing with the inducing drugs, we will take the help of the volatile liquids. So what are they? They are the halothane, isoflurane, sevoflurane, desflurane as well as ether. We have halothane, isoflurane, sevoflurane and desflurane ether. Then finally we have the gas called as the nitric oxide. So this is the classification of the general anesthesia. Parenteral, we have the inducing drugs and slow acting drugs. Inhalational, we have volatile liquids and gas. And these are the examples of the inducing drugs, slow acting drugs, volatile liquids as well as the gas. So now let's look at the complications of the general anesthesia. So whenever you are giving general anesthesia, what are the complications that one must be aware of? So moving on to the first system, that is the cardiovascular system. So what happens in the cardiovascular system? There is hypotension and also cardiac arrhythmias as well as cardiac arrest. So hypotension may be present, it may result in cardiac arrhythmias resulting into cardiac arrest. So the next system, that is the respiratory system. The patient may undergo respiratory depression leading to apnea and also aspiration pneumonia. Now let's look at the central nervous system, CNS. There may be persistent sedation as well. Moving on to the gastrointestinal system, GIT. The patient may feel nausea, vomiting and is also hepatotoxicity. Moving on to the renal system, there is nephrotoxicity as well, and also the finally patient may feel malignant hyperthermia as well. So we can see these are all the complications of the general anesthesia: cardiovascular system, respiratory system, central nervous system, GIT, renal system as well as the malignant hyperthermia. So the complications of general anesthesia are very important for the UG examinations as well. So thank you guys, thank you for watching video till then. Make sure to subscribe and hit the like button and share this video if it is found helpful to your other friends. So Now let's not end here. We'll have a separate detailed lecture on the propofol, thiopentone sodium as well as ketapene. Make sure you watch that next video as well, and also like, share and subscribe. And then you can get access to these lecture notes in the community link that is there in the channel description. Go to my channel and go to the description. We have a community link, and from there you can access the notes of these particular chapters as well. So thank you guys, thank you for watching, and I'll see you in the next video. Bye.